So I chose medicine as a career because of the interest that I had in science. Initially, I wasn't sure I would be a scientist or a physician. Then in medical school, I started to learn about immunology and blood diseases. And then during the course of my studies, I also had personal experiences with family members that developed blood cancers. So that was, in the end, kind of the fulfillment of all those different interests that I had. The most rewarding part of being a doctor at its core is the fact that we're helping people. And there are many ways of helping others, and I think that that's kind of fundamentally the mission of every physician. I like to add that we are here to help people and patients with a purpose. And the purpose, again, is to transform the field. The purpose is not to do the same things that we're doing today, to do them tomorrow or the day after tomorrow. So really, it's a combined joint effect and mission of good, optimal patient care and discovery and advancing knowledge. The questions that patients should ask more really depend on where in their journey the patients and their families are. The initial encounter, it's challenging because patients are in a state, and family members are in a state of shock. They just heard that they may have cancer, particularly a blood cancer in our case, or they know they have it. So they come in with a lot of questions that they had the chance to rehash, on their way to the clinic, or think about it before the appointment. Initially, the questions are really focused on what's going on, what do I have, what are we going to do about it. I think that I like for people to ask more questions about how do you know what I have, how certain we are that that's a correct diagnosis. I think that patients should ask also, how many times have you seen something like this? What do I have is rare or not? And I think that those are initial questions. After that, in the course of the treatment, there will be questions about treatment, there will be questions about outcome, there will be questions about life after treatment, survivorship, and so on. So I think that the questions are different depending on the stage of the journey. I am Dr. Pierluigi Porcu. My mission at Jefferson is to improve lives.